Hi, everyone. Welcome to another video. My name is Chris Scappatura. I'm here with Dr. Sharif Ibrahim, and today's topic is all about high blood pressure. Now, if you've been following us and listening to all our advice about eating well and hoping to be healthy, but you're still having high blood pressure because there might be an issue in the application. You might be eating fruit, maybe even reduced your amount of red meat. But knowing exactly what to do within each one of those is what we're going to be talking about today. So, Sharif, let's get started with talking about the correlation between metabolic issues.
Thank you, Chris. The problem of high blood pressure revolves around this core of insulin resistance. Because we are eating food that contains carbs or contains sugar, and then we want this energy to be taken up by the body cells and convert them into energy and vitality and help us to do things. Unfortunately, if we are not sensitive enough to the effect of insulin, which is the hormone that knock on the door, and then the cell door opens up and sugar come in. But if somebody has insulin resistance, then insulin will knock on the door, but the door is not going to open wide enough to allow a big quantity of sugar to come in. In this case, most of the sugar is going to stay out, and the body will have to store this food. Sometimes the storage can happen around the abdominal organ. And this is the worst type of storage because this is going to be the cause of chronic low-grade inflammation. And this chronic low-grade inflammation that gives people insulin resistance and makes them not very effective in dealing with sugar in their blood pressure control.
Before we talk about the foods, and I know you're excited to do that, let's define and explain glycemic index.
If you take different types of fruits, for example, watermelon and melon, this has high glycemic index, but low glycemic load. So if you eat a small amount of this, then that is not really going to make that big problem. Other fruits like grapes, pineapple, or mango, these have got definitely high glycemic index and high glycemic load. And eating any amount of this is not advisable for somebody with high blood pressure. Somebody with high blood pressure should focus on berries because berries have got plenty of nutrients, have got fiber on them, but have got low sugar on them. And many people prefer to go for ripe banana. Is going to contain too much sugar for somebody with high blood pressure to take.
The green banana is one of my favorites. A green banana or a greener banana is actually good for the gut. The minute it gets to yellow or beyond, you're eating candy essentially at that point because of the sugar content in it. So, Sharif, we all love fresh fruit and we need to minimize the intake or be smart about the amount of intake. There are ways for us to actually buffer the amount of intake.
One of the best examples is the breakfast of yogurts. They can mix berries with seeds. That is going to reduce the amount of sugar in the whole meal, and is going to provide more fiber, which is going to slow down the absorption of sugar, and is going to provide more nutrients, which is going to encourage the body to burn this sugar and make energy. The other trick, if you eat dry fruits with nuts, people eat dates with peanuts or cashews. Nuts have high fiber and have got the high nutrients as well. And so that is going to buffer the amount of high sugar to help the body to process this into energy.
So it's much better to eat whole fruit. But again, there's always a cautionary tale here. People will go and eat dried fruit.
Yes, because the dry fruits, you have the fruits and you take the water out and allow the fruit to ripen for longer time, allowing the fruit to increase the sugar content. And when you take the water out, then you end up having a very high concentrated sugar, and which might be a double or even triple the amount of sugar.
Now, one of the hidden ones that we've talked about in the past, Sharif, is juices. A lot of people will go to the grocery store and they'll pick up orange juice by the gallon and bring it home and feel good that they're eating healthy. But that's a misconception again.
This is true. People think fruit juice is healthy, but everyone will think fruit juice is healthy. they have to think again. Because fruit juice is sugar. Most of the time you see it's high fructose corn syrup, which is the worst type of sugar, added to fruit flavor and coloring agents. So it's not going to be the best thing for anybody with high blood pressure or with metabolic syndrome to take, because this is going to have a very negative effect on blood sugar control and blood pressure control. Why? Because there is no fiber here, and fiber is slow the absorption of sugar. On the other hand, the nutrients is missing here. It's mainly vitamin B1 and vitamin B2 and vitamin B3. These are really very important for the processing of sugar into energy.
Now, let's talk about caffeine with high blood pressure and the issues related to this. Someone who is trying to eat healthier and they only have maybe 2 cups of coffee a day or tea, that's still raising alarms to the body.
When we are talking about blood pressure control, caffeine becomes really very interesting, because caffeine actually increases the amount of adrenaline in the body.
Yeah, it's no doubt that adrenaline can really have an effect on your heart rate and then ultimately on your blood pressure. Now, for those people who are already having these conditions, Sharif, they should steer away from caffeine, but there are some foods that they can eat to help themselves right now.
For those who have already got the problem, I think it would be sensible to go for low-calorie veggies like cucumber, celery, even carrots. They're all really very low in calories. Often they describe them as having negative calorie value, because eating them and chewing them and digesting them sometimes costs the body more calories than what you get out of them. This should be the destination for anybody who would like to control their metabolic disease and to control their blood pressure. They have to take more of these low-calorie veggies, because this is going to make a big difference in control of their metabolic syndrome and associated chronic diseases like high blood pressure.
That's awesome, Sharif. Thanks for all the great information again today. Thanks so much for everyone for listening to today's video. We look forward to seeing you on the next one. Take care. Sharif and I appreciate you liking this video, and more importantly, remember to subscribe to this channel. There's a lot of content that we're going to be creating, and we don't want you to miss a single second of it.